Good evening, sir.
Good evening, all. This is Chandramohan, physiotherapist. An announcement is there today. You can see the screen, and ExRx India is organizing a conference that is India's first ever free international e-conference. Theme is during and post-COVID physiotherapy care. It will be held on 5th and 6th June, full day event. There will be a break time also, morning 2 hours, and afternoon there will be 1 hour session, and evening 2 hours. And there are 2 scientific sessions, and each scientific session has 5 lectures. And the registration is completely free. Eligibility are physiotherapy graduates only. Interns too. So here our resource persons are going to discuss more about protocols and all those things. So it may be difficult for you, and we are planning for students also later onwards. And the last date for registration is 4th June. And those who have registered must attend all the sessions. We have 10 members to take attendance. So you have to put your registration number and along with your name only. Do not use your phone number or email IDs. So that is not acceptable. And before registration, read the terms and conditions. And also, we have planned for post-conference e-poster presentation. The last date for registration for e-poster is 10th June, and the poster presentation is on 13th June. And the program is live on Zoom and also in Fitness and Rehab India YouTube channel. Only for discussion, we will be providing the Zoom ID. Those who have doubts, they can join and discuss. Once the discussion is finished, you should leave the Zoom, and again you can join. In case if you are not leaving, we will remove, then it will be difficult for you to join. Maybe you can join for the next day only. And you can download our brochure in our website, ExRxIndia. It's given in the right lower corner of the flyer. You can see there. You can go there and register, download the brochure, and also template is also there. So you can see cursor is moving there. So it's yes. Thank you, Rupesh. And you can register. Once you register, you will get registration successful. And you should wait till every details uploaded. And you can see the message that after you have to take screenshot of your details, and you should keep it with you till you receive your certificate. And also you should submit your graduation proof to the concerned person mentioned in that registration successful banner. So you can see all the details once you get registered. And once again, I request read terms and conditions. Thank you. And for today's PGET session, I welcome all the participants in Zoom and also in our Fitness and Rehab India YouTube channel. Without wasting much time, I welcome our resource person, Dr. Arun Balasubramaniam, physiotherapist who is working in government headquarters hospital, Erode. And also I welcome my team, Dr. Rupesh and Tuna madam. Now I welcome you, sir. Dr. Arun Balasubramaniam, sir, please start the session.
Is the slide
yes,
visible,
sir. Yes, sir.
So, shall we start?
Yes, sir.
Yeah, good evening, friends, and we are back today on the multiple choice question on the ExRx India. I would like to thank Chandra for giving as discussed in the last classes. We are also going to see today the exercise therapy only. I think till the June end, we are going to run along with exercise therapy only, because there are more and more components of exercise therapy. We will be looking lot of things on the exercise therapy. Although today's chapter is very, very easy for you, probably you might be able to answer all the questions very, very easily. Still, I think some of the questions will be a little difficult. It's not much difficult for you. Same template as you are following my class 5 classes. The same template. I have few questions and a few pictures. You have to say the pictures. Unlike last classes, I don't have all the posters or pictures related to the derived questions, whereas I have pictures on exercise therapy also. Right? So without wasting much time, we will go into the first class. The first question. Right. This is a question number one. Detrimental effect of overstretching is. What is the main ill effect of overstretching? Is it joint dislocation, fractures, instability, or muscle tear? So what is the ill effect of overstretching? Is it joint dislocation, joint instability, fracture, or muscle tear? Please kindly answer it in the chat box. Joint dislocation, muscle tear, or instability, or fractures. Muscle tear is not the right wrong answer, but still, so still, it's one of initially it will not happen. The first one happening is the joint instability. Because when you do overstretching or excess stretching, it causes first joint disability, joint instability. So instability may result in the subluxations as well as may prone to dislocations. Muscle tear will be very common if the muscle is very tight or there will be a spasm in the muscles when you try to do stretching, which causes muscle tear. But for normal muscles, the joint instability will be the main detrimental effect of overstretching. Move on to the second question. Okay, when we look at the suspension, right? So the length of the sling of suspension is, so we have practiced our suspension in the basic exercise therapy. What is the length of the sling of suspension? Is it 68 centimeters, 98 centimeters, 50 centimeters, or 120 centimeters? That's the sling. The sling we use to keep our forearm, arm, or the leg or the thigh. So what is the length of the sling suspension? The sling, that is single sling. But both the sling, single and double sling, has the same length only. Only the breadth is different. The length is same. Is it 68 centimeters, 98 centimeter, 50 centimeter, or 120 centimeter? Well, everyone answering the 98 centimeters. Any good answers? Subha Pragati has put a correct answer. So the length of the sling of suspension is 68 centimeters is the right answer. When we look at the single suspension sling or the double suspension sling, both the length is 68 centimeters, whereas the breadth is for the single suspension is 17 centimeters, whereas the double suspension is 29 centimeters, right? So the breadth width is the 29 and this is 17 centimeters. Three sling suspension. So the which used for the arm or for the ankle and all, it is usually a 17 centimeters with the 3 or 4 inch wide, only 3 or 4 inch wide, but the length is the 17 centimeters, 71 centimeters, right? So we have used this sling suspension, but we are not aware what is the length of the sling suspension, which is very clearly given in the model police, the textbook of exercise. Right? Probably if you refer in the police book, you are able to identify the answers. Right, we'll go on to the next question. Hypermobility of the joint occurs because of all the following, right? Except short-term immobilization of the body segments, like hypermobility. So there is a restriction of the joint. Muscle imbalance, tissue trauma, or sedentary lifestyle. Hypomobility of the joint occurs because of all the following, except hypomobility. Hypomobility means there is a restriction of the movements, right? So the range of motion got restricted. There is less range of motion. See. And the answer is not muscle imbalance. Muscle imbalance may also cause hypomobility. Sedentary lifestyle also got hypomobility. I think only one has put the right answer is Priyanka Singh. And now Girija, Subha, Pragati, Anjali, yes, everyone has start thinking about it. The actual correct answer is short-term immobilization of the body segments. Usually, hypomobility occurs following a long-term immobilization. When you kept the joint for following a trauma or following a fractures, if you are keeping the joint for 4 weeks, 6 weeks, 8 weeks, and the joint was immobilized, then you will get a hypomobility. There's a restriction of joint range of motion in these joints because it was kept for longer time. but shorter time immobilization doesn't get the hypomobility. Okay, muscle imbalance. When you make the wrist in the neutral position, there is a co-contraction occurs between the flexors and extensors. So if there is any overactive of the muscles, like flexors goes overactive, which results in wrist drop. So this causes muscle contraction, results in hypomobility. Tissue trauma, right? So any injury to the tissues, like my index finger got injury, so I was not able to move, so which also causes hypomobility. Sedentary lifestyle. When you assess any individuals who are having chair-bound habits or who drive longer duration of the traveling using bikes, when you assess their hamstrings, the 90% of the individuals have hamstring tightness because sedentary lifestyle. So all the muscles goes for tightness or the flexibility of the muscles gets decreased in the during long-term immobilization. So sedentary lifestyle also cause hypomobility. So this is like little tricky questions, right? It's not hard, it's little tricky. Okay, very easy question. Which of the exercises are considered to be important element of fitness? Which exercise is considered to be important element of fitness? Is it active stretching of joint, active range of motion, passive range of motion, stretching, or free exercises? Exercises to be the important component of fitness. Is it active range of motion, passive range of motion, stretching, or free exercises? Stretching is the correct answer. Very good. Everyone answered correctly. Because when you want to produce or when you want to maintain the fitness or when you go and see the gym, the first thing they will teach you is the stretching. Because stretching only maintains the muscle length appropriately. Once the muscle length was there, then strengthening of the muscle will be very easier. Because tightened muscle, you are not able to go for strengthening. Same as weakened muscle also, you are not able to go for strengthening. So stretching is very important. Passive range of motion usually given for the weakened muscle. Active range of motion or free exercises given for the normal muscles, although it doesn't part of the fitness. Very good. Everyone has put a correct answers. Okay, what is this PNF technique? It's for upper limb only. What is this PNF technique? Upper limb PNF. Don't think about the trunk. In rare cases. D2 flexion. Okay, Girija has come very near. Do extension. D2 extension is the right answer. Very good. So when you read when we are doing postgraduate, we always used to read the textbook of occupational therapy book. I don't remember the name of the occupational therapy book. We used to read that. In this textbook, they have given examples of activities of daily living in connection with the PNF. So this also I just took it from the internet randomly. Research I was able to find it out. The functional activity for the D2 extension is buttoning the pant on the opposite side. So when you are right hand side, left hand side, turn it and button it. This movement is the D2 extension where the scapula is in abduction, rotation, and depression. Shoulder is abduction, internal rotation. Elbow is in flexion or supination. Elbow is in flexion and forearm is in supination or pronation. So this is a pattern of D2 extension, which combined with the normal medial activity. So patient is trying to put the button on the opposite side of the pant. The next class also I will try to find out some of the PNF questions. Okay, so the question number 5. Contractures is a result of intra-articular pathologies. Contracture occur as a result of intra-articular pathology. Is it a fibrotic contracture, arthrogenic contracture, myostatic contracture, or pseudomyostatic contracture? Contracture is a result of intra-articular pathologies. Fibrotic, arthrogenic, myostatic, or pseudomyostatic. Subha, correct answer. Correct answer. It's contracture. When we speak about the joint, it is arthrogenic. So joint is arthrogenic only, right? So joint, when we speak about joint, is arthrogenic only. Fibrotic means it's based on the fibers, and myostatic is no muscle pathology. And pseudomyostatic means look at the myostatic, but it is not actual. I think I have given questions for you, pseudomyostatic, myostatic in your question papers, right? When you open your question papers and tomorrow, so I will identify. Okay, question number 6. All the following statements are true about incoordination. Listen, all the following statements are true, except one is a false statement here. Everything is true. During exercises, the patient should be guarded against fall. So you should be careful on taking care of the patient. Worst limb should not be exercised too much. We should not give too much exercise to worst limb. Give adequate rest to the patient because excessive exercises cause fatigue. Every movement performed should be watched the patient. So patient should watch the movement, right? So incoordination, all the statements are true except one. Kindly answer. Okay, I think I have got only 2 answers.
Even people who are watching in YouTube, you can put the answers. Actually, they are answering, sir, here.
Yeah, all the answers are correct. The B is the right answer because the worst limb should not be exercised too much. Actually, worst limb also should be exercised. That is the limb we have to concentrate. So you have to take care of the patient against fall. That is very important. You have to give adequate rest to prevent fatigue of the muscles. So incoordination exercises or tedious exercises. The patient has to be guarded against fatigue. And every moment should be watched by the patient. So the patient brain will remember it, recall it, and they will do that. And the wrong answer is worst limb should not be exercised is not the right answer. It should be exercised, right? So worst limb should be concentrate more. Actually, in coordination, both the limbs are equally affected, but in some cases, if the left side limb is more affected, we have to do a lot of exercise for the left limb. Right? Everyone has given a right answer. I think everyone. Those who put the answers in the chat box, everyone has given the right answers. Right. So if the patient assists in moving a joint to a greater range is called as. If the patient assists in moving a joint to a greater range is called as active stretching, passive stretching, assisted stretching, or self-stretching. Patient assist in moving to a greater range is called as active stretching, passive stretching, assisted stretching, or self-stretching. As the question itself, we got the answer, right? So it's very easy to pick up, right? So the question, the answer for this 7th question is assisted stretching because the patient is assisting through the range of motion. Passive stretching is the type of stretching where patient doesn't have control over it. You are doing passively to get a range of motion. Active stretching or self-stretching, patient himself is doing it, right? He himself is volunteer in producing the movement. Whereas assisted stretching is that when the patient is doing, the physiotherapists are doing, patient also assist in maintaining or bringing the range of motion. It's called as assisted stretching. But usually in clinical practice, we are not doing the assisted stretching. We always do a passive stretching, and we will teach the clinical active stretching to the patient to do them as a home program. So, assisted stretching are very less concentrated. Okay, another easy question. Contraindication of stretching includes all except. So all these are contraindication except one. What is that? Is it bone block, scar tissue, recent fracture, sharp or acute pain? Which is the not the contraindication. Actually, it is indication for stretching. Is it bone block, recent fracture, scar tissue, sharp or acute pain? Very good, very good. Yeah, all answers are right. Excellent. It's these scar tissues, right? Because if there's a bone block, you should not do stretching because excessive stretching of the bone block causes fractures. Like elbow extension is the restricted by the Olkiman process, right? When you do further extension of elbow, this results in fractures. Recent fractures, you should not do the stretching because recent fractures was the fracture is getting healed or the muscles or soft tissue surrounding the joint are not in a proper position, which is responsible for holding it. When you do stretching, it will aggravate or it will cause refracture to the bone. Sharp or acute pain, we do not know whether what happens to the joint because sharp or acute pain has got muscle guarding. So when you start stretching it, you are going to break down the guarding or break down the acute muscle spasm, which may cause bigger injuries. So you should not do for sharp or acute pain stretching. The only correct answer is this scar tissue. Scar tissue is not the contraindication, it is the indication for stretching. Like everyone has given a correct answer so far. Those who answered are all correct. Right. What is the question of Virat Kohli? It's a derived question. That is a question of the article. As like I told in the last class, you cannot see same as the textbook position, but still this is one of the position. More or less same. Yes. Stoop standing. I still remember my exercise therapy classes because my teacher always told me to told our batch to write down the assignment on the derived question. So we are able to remember. But that time only I was able to remember. Don't ask me. Now I just look at the textbook and identify. Okay, this question is called as fallout standing, where the patient for one leg is forward and other leg is backward. It's called as fallout standing. Right, we are more. I just mixed up all the questions, so you have random questions from the stretching, from the crutch walking, and from the suspension and all. Okay, while measuring axillary crutch for hand piece, the elbow should be flexed to 20 degrees, flexed to 15 degrees, flexed to 30 degrees, flexed to 45 degrees. So what is the flexion of elbow in axillary crutch? 20 degrees, 15 degrees, 30 degrees, 45 degrees. Okay, most of them has given a correct answer. Very few, like 1 or 2 people have given some wrong answer because of the values. Like one thing I just want to tell you is all the things about crutches is only 15 degrees of elbow flexion. Please remember that 15 degrees is flexion of elbow. Either you are going to measure for elbow crutch or you are going to measure for the axillary crutch. 15 degrees is the fixed position, right? So any crutches you have to measure only elbow kept in the 15 degrees of flexion. You are going to measure for the elbow crutch also this 15 degree flexion, or axillary crutch also, hand piece also 15 degrees of flexion. Why this flexion is very important? Because it has to be avoided to avoid compression in the axillary area. Axillary region compression causes nerve injuries. Okay, what nerve injury? I'll ask you one more question in the later slide. That time we'll discuss more about the axillary crutch. But axillary crutches are very important. When you are weaning a patient from the walker, the first thing you have to give is the axillary crutch, because the patient was able to once walk with the axillary crutch, then you can wean it and then give a elbow crutches. Sometimes patient was able to come from the axillary crutch straight away to the elbow crutch also. Sometimes you can go only with the wall sticks also. So depends on the patient. We have to choose the appropriate equipment, appropriate walking aids. So the answer for this question or any question related to the crutch walking is what is about the degree of elbow flexion is 15 degrees is the appropriate answers. Okay, in crutch walking, the same question. All the muscles has to be assessed prior to the crutch walking, except which muscles we will not concentrate. We will least concentrate on which muscle. Is it hip abductors, knee extensors, hip adductors, or ankle plantar flexors? Which muscle is least bothered in assessment of crutch walking? Because when you start doing a crutch walking assessment, we have to assess the lower limbs first, because the lower limb is the one which going to stabilize it, especially the normal limb, sound limb. Sound limb has to be assessed very good, and you have to assess the muscle power of the sound limb, so that the sound limb is the one which carries more weight to the body, which has to be maintained or stabilize the body. So we have to assess the sound limb correctly, as well as upper limb also, which helps to hold the crutches. Everyone has put a correct answer. It is the hip adductors, because all the other muscles, hip abductors are important in assessment. The extensors are important. Ankle plantar flexors are very important. Hip adductors are not much important, but still we can assess it, right? But it is not much concentrated. If hip abductor is okay, then we can make the patient to walk. Everyone is given a correct answer. Okay, myostatic contracture is no specific muscle pathology, intra-articular pathology, fibrous change in the connective tissue, or spasticity. I think I have told the answer in the previous slide. What is myostatic contracture? Is it no muscle pathology, or intra-articular pathology, or fibrous change, or spasticity? Fibrous change is myo means muscle. Myo means muscle. And I think you are not followed the previous question. I have given the answer in the question itself. It's not D, it's not C. C and D are the wrong answer.
No, the options are A and B.
Yes.
Try in that place. It became like a Kaun Banega Crorepati. Call your friend option should answer. We have.
Yeah, I just remember one of the Tamil joke, right? I just take one more time to tell that. In one serial of Tamil, like old serial, they give a clue to the person who is the first prime minister, and the opposite person is asking, please give me a clue. Then he'll say the first letter starts with May and the last letter starts with Ru. There is nothing in between it. But still, the person says Gandhi.
Yes, sir.
I told A and B and they are putting C. What is
C and E.
Okay, the answer is there is no muscle pathology, is a myostatic contracture because as a muscle itself, myo means muscle, so there is no muscle pathology actually here. I think there are 2 or 3 questions given in the same content only. All the answers are same, only the questions are different. In your question paper, you are going to get tomorrow. Okay, question number 12. All the following statements are increasing resistance to the muscle action. All the following statements which helps to increase resistance to the muscle action. So which improves the resistance, except increase poundage, increase leverage, maintain the speed of movement, or increase duration of exercises. So increase poundage, increase leverage, maintain the speed of movement, or increase duration of exercises, which is not the the thing which doesn't help to increase the resistance, increase the muscle power. So increase poundage, increase leverage, maintain the speed, or increase duration. Increase duration, you have to increase duration so that your muscle power will be enhanced. Right, so initially I start doing for 10 minutes, then you have to say start doing for 15 minutes, then only I do 15 minutes, and then my muscle power will be increased. Right? So the correct answer for this question is maintain the speed of the movement. The speed should not be maintained. You have to alter the speed of the movement. Right. So to improve your patient, you have to increase poundage, so increase the weight. So patient will not be doing 5 kgs till after 4 weeks, after 6 weeks, after 8 weeks, which is not there. You have to increase the poundage. So the 1 week you are giving starting with the 5 kgs, then the next week you have to give 7 kgs, 8 kgs. So you have to gradually increase it. Increase the leverage. Leverage also helps to increase or alter the direction, also helps to increase the muscle power. So that has to be increased. Increase duration of exercises. Duration also has to be increased because the exercise duration is same duration is not helpful. So you have to increase the duration. The very important is you have to alter the speed of the movement. The speed has to be increased because the speed has to be increased. You have to not maintain the speed, right? Either you have to lower the speed or increase the speed. Depends on the patient, right? So that has to be taken care when you are giving a prescribing resistance exercises. Okay, what is the name of this exercise? I think I will get all correct answers only. If you are not Tamilian, you don't know who is this. Band exercises. Yes, very good. Correct answer. Band exercise is the correct answer, right? Band exercise firstly was discovered by Chinese. Surprisingly, they only discovered this band exercises and they only started doing exercises for, especially it is used for the upper limb. Exclusively for the shoulder, these band exercises helps to improve the range of motion in the shoulders, right? With the help of the stick, they are able to increase the range of motion. Okay, so back to stretching. A rapid, forceful, intermittent stretch with a high speed, high intensity is rapid, forceful, intermittent stretch with a high speed and high intensity is. Is it a static stretching, cyclic stretching, ballistic stretching, or PNF stretch? As the word itself says, rapid, forceful stretch. So when we say it is a rapid, forceful stretch with high speed, high intensity, it is none other than the ballistic stretch. Okay, ballistic stretch is a rapid stretch. That's why we are going to give the sudden movements occurring in the stretching. we are going to give only for the athletic population, not for the non-athletic population. Because what happens in the ballistic stretch is if you are going to give for a non-athletic population, it causes injury to the muscles. The muscle tear is very common in the ballistic stretching. So we have to very careful on selecting the ballistic stretching. Usually ballistic stretching is advised for the athletic population only because they want a rapid forceful movements which with the high speed and high intensity. Right? So these stretching is not given for the conventional physiotherapy used by the sports physiotherapist only. Right? So because of risk of injuries. So everyone has given correct answers. So we'll move on to the 40th question. While standing on a single leg, which muscle contract and maintain the pelvis in neutral? Very easy question. I think everyone will hit this. Which muscle has to act? Abductors, flexors, extensors, adductors. Adductors, flexors, extensors, abductors. So pelvic tilting, right? Of course, everyone knows it. When you want to maintain the pelvis, when you are single leg standing, you have only one muscle to act. That is the gluteus medius. So gluteus medius is the powerful abductors of hip, right? So hip abductors only helps to maintain the hip in the neutral position. When the hip is not maintaining it in the neutral position, when the hip is not maintaining it, then there is a weakness of the hip abductors. You can see a pelvic drop here, right? So the hip has to be maintained neutral position by the hip abductors. Gluteus medius play a major role here. Right. Question number 15. Tendency of the soft tissues to assume a new and greater length after a stretch force has been removed. Tendency of the soft tissue to assume a new and greater length after the stretch force has been removed. So the stretch force is removed and still it reaches some position. What is that is called as elasticity, plasticity, viscoelasticity or stress. The tendency of the soft tissue to assume a newer greater length after the stretch is removed. It goes into the greater length. It occurs a new position. That is also one clue. Go to the newer position. It is not stress. Don't confuse. Stretch is a filler. I don't know what answers to give. Just a good stress. Okay, when you go to a newer position, so now only you are thinking, right? So when the soft tissue is when you are doing stretching and you are going to get a new position. For example, if a patient comes with a 90 degrees of hamstring tightness, and you are going to stretch the hamstring muscles to improve it to 110 degrees, right? So that position is a new position, right? So the position will not come back. Once you achieve 110 degrees, will not come back to 90 degrees. So this 110 degrees is a new position for the patient. So it is not called as elasticity. Elasticity means it has to come back. So it is not called as elasticity, but it is not called as viscoelasticity. It is called as plasticity because we got a new range of motion. From 90 degrees of hamstring flexion, we are going to increase us to 110 degrees of hamstring stretching. So the hamstring length is now 110 degree. The patient has to maintain it in the 110 degree. So the maintenance of 110 degrees is the plastic range. So we are going to maintain it the plastic range, right? So don't think about Young's formula of Young's modulus of elasticity of stress and strain, where the plastic range and the end point, right? So it is not the end point of flow region. The plastic range where the once you achieve the range, it will not come back to the normal position. That is called as plasticity, right? Especially in the stretching. Move on to the next question. When the joint is in immobilization, the muscle should be kept in dash position to prevent atrophy. Which position you have to keep the muscle during immobilization? Very simple question. It's a shorten position, lengthen position, mid-range or neutral. Which position you have to keep when the joint is in immobilization? As a therapist, we are going to give some braces. So which position you have to give the brace? Shorten, lengthen, mid-range or neutral? You can see a lot of correct answers. All these joint has to be maintained in the lengthened position because shortened position encourages the hypertrophy of the muscles. Hypertrophy results in The muscle goes for wasting as soon as possible. So shortened position should not keep. You have to always keep muscles in the lengthened position, like a brace. The wrist brace you are giving, it has to be maintained in the neutral position, lengthened position. There is no flexion or no extension, so that the length has to be maintained and it prevents early muscle wasting, right? So you have to maintain it in the neutral lengthened position only. In some cases, the hand injuries, we always say you have to keep the hand in the glass holding positions, right? Okay, which muscle is getting stretched here? Very easy question. Ultimate easy question is this. Which muscle is stretched there? Lonis muscle. Successful captain of India. Hip adductors, very, very good. Hip adductors are the muscles which get stretched here. Hip adductors, very good, excellent. Everyone has put the right answers. Hip adductors. Very easy question. Okay, coming back to the crutch walking, axillary crutch could cause which nerve palsy? Axillary nerve, musculoskeletal nerve, median nerve, radial nerve. Which nerve gets paralysis in axillary crutches? Axillary crutch, axillary nerve is the wrong answer. I told axillary nerve is the wrong answer. It's not axillary nerve. So you have to think about other three only. Musculoskeletal median nerve or radial nerve. Probably it is not median nerve, so we are more aware of that. Median nerve will never get compressed in the axilla or in the upper arm, right? Especially in the arm, it will not be compressed. Either musculoskeletal nerve or radial nerve, and unfortunately, very few has answered correctly. It is the radial nerve. Radial nerve gets compressed in the axillary crutch, as well as the lower brachial plexus. Lower brachial plexus compressed on the axillary crutch. And that's why we are always advised to keep a 2 to 3 finger width of between the crutch and the underarm, or the pad of the axillary crutch and the axilla. That's why always when you are measuring axillary crutch, you have to keep 5 centimeters down from the axilla to the medial mandible. This is the measurement for the axillary crutch. When you are taking the measurement, the 5 centimeters is you should not ask the patient to lean on the crutch. That's one of the important instructions you have to give. You have to keep the fingers and find out whether it is 2 finger length or 3 finger. At least 2 fingers has to be maintained properly, so that the patient will not put more weight on the axilla, the axillary pad, which causes compression of the nerve results in injury. Okay, the same crutch walking. Measurement of elbow crutch is from where you are going to measure the elbow crutch. Is it from the radial head, olecranon process, radial styloid process, or ulnar styloid process? Radial head, olecranon process, radial styloid process, or the ulnar styloid process? Styloid process. I'm sorry, I don't know which book we have referred. I never think about radial styloid process. Correct answer is ulnar styloid process. I don't know why you all put radial styloid process. Ulnar styloid process is the measurement you are going to take it for the elbow crutches. The elbow has to be bent for 15 degrees of flexion, and we have to measure from ulnar styloid process to the medial malleolus or lateral malleolus with shoes on, shoes off. Sorry, I do not know whether the radial styloid process is the correct answer, because some of you has answered it as radial styloid process, and I'm not sure about the radial styloid process. Of course, radial head is not the correct answer. Olecranon process is not the correct answer. Right? So A and C is not the correct answer. As far as I have read, it is D only, because I have referred from Dina Garner textbook of exercise therapy. If you have any references for the radial styloid process, please go ahead. Because some of you has put radial styloid process. I also bit confused whether it is radial styloid or ulnar styloid, but as per the Dina Garner, it is ulnar styloid process. Okay, we move on to the next question. Okay, generalized muscle weakness associated with the cerebellar lesion is called as asthenia, dysmetria, dysarthria, asymmetria. generalized muscle weakness associated with the cerebellar lesions. It's asthenia, dysmetria, dysarthria, asynergia. Asthenia, dysarthria, dysmetria, asynergia. Of course, asynergia is not the correct answer. You all know well. Muscle weakness, how it is dysarthria? Strong answer, right? Any answers? Okay, so the generalized muscle weakness associated with cerebellar lesion is asthenia, it is called as. It's not dysarthria. Dysarthria means inability to speak is dysarthria. Okay, gutter crutch usually recommended for patient with. So gutter crutch, you all know that patient walks with the elbow supported, forearm supported crutch. Is it for upper limb burn, severe knee valgus, rheumatoid arthritis, elbow fractures? What is the indication for the gutter crutch? Is it upper limb burns, rheumatoid arthritis, severe knee valgus, elbow fractures? Gutter crutch. We also developed some modified form of gutter crutch in our outpatient department. Because patient with severe conditions, severe arthritic conditions, we are unable to make the patient to walk with a walker. So we have designed it as a gutter walker. Right? So answer C is the right answer, right? So people try to put answers. Right answer is C. So usually we recommend it for the rheumatoid arthritis because patient with the rheumatoid arthritis doesn't be able to hold the fingers. Fingers grip is lost. So they can walk with the help of the forearm. So using the forearm is tied up and they can use forearm as the walker and then they will walk it, right? It's a model, so he holds it tightly, but for the rheumatoid arthritis patient with severe finger deformities or severe contractures, swan neck peritoneal deformities, they are not able to hold it tightly. So they use the forearm as a support for progression, like walking. The gutter crutch usually recommended for rheumatoid arthritis. Okay, which muscle is stretched here? Very easy question, right? You think you can answer. Which muscle is stretched here? Which muscle? Name the muscle. Name the muscle. So lower limb muscle. Okay. Giri is half right. Tendo actually is a common term. I am asking muscle. Muscle. Only one muscle is stretched here. So yes, very good. Any good answers? Very good. Excellent. Because when you do a soleus stretching, you have to keep the knee in flexion position. Whereas when you do a gastrocnemius, you have to keep the knee in extended position. So extended position with the same stretching is for the gastrocnemius. With the knee bending is for the soleus. I think in the practicals of the exercise therapy of stretching of soleus also you done with the knee flexion. Whereas when you stretch the knee is for the gastrosoleus, right? So gastrocnemius also it stretch as well as soleus also stretch. But knee flexion when you do in this position, it is exclusively for soleus muscle. So have a little think over it and then answer. Okay, question number 21. Coordination refers to the integrated performance of two or more limbs working together is called as. Coordination refers to the integrated performance of two or more limbs. So two or more limbs are working together is called as intralimb coordination, visual motor coordination, interlimb coordination, eye-hand coordination. So intralimb coordination, visual motor coordination, interlimb coordination, or eye-hand coordination. Coordination with the integrated performance of the both the limbs. Very good. I thought this would be the tough question, but for this you are able to answer very quickly. Whatever the questions I thought previously, it is very easy and you are finding difficult. Maybe there's a gap between the teacher and the student. I thought this would be a tough question, which I think, very tough question I have put. But everyone has hit a sixer for this question. The interlimb coordination is the integrated. So what is intralimb coordination? Intralimb coordination is the movement occurs in a single joint, like elbow flexion extension. That is an intralimb coordination. Whereas when I do bilaterally flexion extension is the interlimb coordination. Visual motor coordination is nothing but when you ask the patient to ride a bicycle. So visually as well as motor he was able to do. Or ask the patient to draw a line in the zigzag position. So like tracing. So tracing a coin, or you can give the, for kids and all, we will give the tracing diagrams, tracing pictures. That is a visual and motor coordination. Or riding a bicycle, walking in the straight line is a visual and motor coordination. Hand-eye coordination is ball bouncing or balloon holding. Like so, you can tap the balloon and hold the balloon in the hands. Like that is a hand-eye coordination. So hand and eye will be coordinated. Or catching the ball catching is also a hand-eye coordination. Right? So excellent. Everyone has given right answers. Okay, very easy question. Duration of mechanical stretching is as based on the literatures 10 to 20 minutes, 15 to 30 minutes, 20 to 45 minutes, 45 to 60 minutes. What is the duration of mechanical stretch? 10 to 20, 20 to 30, 15 to 30, 20 to 45, or 45 to 60. So as per the literature, it says the right answer is 15 to 30 minutes for the stretching. Right? Every stretching has you have to hold it for 30 minutes. Okay, maximum weight that can be lifted 10 times at a natural speed, right? Without rest between the lift is called as 1 RM, 5 RM, 10 RM, or 15 RM. This is also very easy question. Answer is found in the question itself, right? Maximum weight that can be lifted 10 times at a natural speed without rest, and the lift between the lift is 1 RM, 10 RM, 5 RM, 15 RM. Very easy. It's not A is right, wrong answer. The answer was given here 10 repetitions, 10 times. So it should be 10 only. So please read the question carefully when you are going to write exams within 1 or 2 months. If you are just carried away with your answers, it is not right. You have to read questions once or twice before writing the answers. Once you shade your answers, that's it. You cannot change it. So before shading, please read the question and confirm it whether the answer is right. Because it was given as 10 times and it is 10 repetition maximum. Maximum weight lift at 1 time is called as 1 repetition maximum. Maximum weight lift at 5 times is 5 repetition maximum. 10 times is 10 repetition maximum only, right? Without rest. So please read the questions and then go give the answers. Don't carry away with the questions and start writing the answers, because when you are going for the exams and when you are shading the sheets in the pen or in the pencil, the pencil also you have a chance to rewrite it. But if it is a pen, that's it. Once you put a wrong shading, means gone. Well-known questions you are writing a wrong means it's very difficult to digest. So please read the questions thoroughly and then answer it. There is no hurry-burry here, right? You can take your time. We are not forcing anyone to give the answers within the time. Right. So this is one of the very easiest question. True limb shortening is measured from dash to lateral manus, umbilicus, lateral trochanter, xiphisternum, or lower ribs. True limb shortening measured from umbilicus, xiphisternum, lateral trochanter, or lower ribs. Umbilicus, xiphisternum, lateral trochanter, or lower ribs. True limb shortening is measured from. From what? Xiphisternum, umbilicus, xiphisternum is not the right answer. Like as I told you before, what I thought is very easy question find difficult for you. What I thought difficult question for me, it is very easy for you. This is one of the very easy question. This is the one which you are going to do it for all your practice. When a patient comes with any lower limb problem, the first and foremost thing what we are going to do is the limb length measurement. So we have two limb length measurement. One is called as apparent limb length measurement and the true limb length measurement. Apparent limb length measurement are the measurement taken from the umbilicus or the xiphisternum to the medial malleus is the apparent limb length, because the patient has some limb length difficulty or the squaring of the pelvis is not possible. The pelvis is not in the neutral line. So we are going to go for the apparent limb length shortening. That is more or less okay, right? So from that you have to measure. For that you have to measure from the either from the xephisternum or from the umbilicus. Whereas true limb length shortening is for the patient with the pelvic is squaring, the pelvis is neutral position. Then you have to measure from either ASIS to the medial malleolus or the greater trochanter to the medial malleolus. So you have to go for either greater trochanter or ASIS. Only for the apparent limb shortening, you have to measure for the umbilicus or the xephisternum. True limb length shortening is measured from the ASIS or the greater trochanter. In some conditions, we have to have a partial measurement from greater trochanter to the malleolus, the tibia to the greater malleolus. Part measurement can also be done to identify which part of the limb is shortened. Sometimes only the femur is shortened, or sometimes only the tibia is get shortened. So to identify which bone is shortened, then we can have a part by part measurement, right? But I don't expect you can put the wrong answers for this question. This is very bad. These questions are very easy. You have to. Okay, what is the name of this exercises? So many of them has. I seen the patient doing these exercises, especially in the OG clinic. We always prescribe it. When we go for OG questions or for prenatal postnatal mother, we always teach these exercises. What is the name of this exercise? It's not Kegels. There is a clue here. The patient lies in something, so that is a clue. It's not Kegels. Kegels also done this question. Like Subha has got the right point. Very good. So these exercises are called as pelvic lock exercises, which helps to improve the neuromuscular coordination for the pelvis as well as for the hip joint, like for the lower abdomen, like for the lumbar muscles as well as pelvic muscles, and for the hip joint to improve the neuromuscular coordination. So make the patient lie in a crook-lying position. Ask the patient to go for the 4 positions: 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock. So 12 o'clock and 6 o'clock is for the anterior and posterior pelvic tilting. 3 o'clock and 9 o'clock is for the lateral tilting of the pelvis. So anterior and posterior tilting and lateral tilting of the pelvis has to be done by the patient with the controlled movement. So patient has to do pelvic rocking. So pelvis anterior posterior movement for the 6 o'clock to 12 o'clock, as well as lateral pelvic movement for the 3 o'clock to 9 o'clock. So this helps to improve the neuromuscular coordination of the hip joint as well as the lumbar muscles. Right? So this is called as pelvic clock exercises. That's why the clock picture was there. So to make the patient to remember 9 o'clock, 6 o'clock and all, we have to remember it. Okay, very easy question. Progressive resistance and low repetition increases what? Coordination, power, flexibility, endurance. Very easy. Progressive resistance and then low repetition. Dia. Oh my God. It's not D. So the answer for this question is either B or D only. Right? It's not coordination, it's not flexibility. That's obvious. Either B or D only the answer. Right? So that's why I'm always advising you, please read the question clearly. This progressive resistance with low repetition. Always the high resistance, low repetition improves muscle power. Low resistance, high repetition improves endurance. Right? So to improve power, you have to have more weight and then repetition. Right? So 5 kgs, do it for 5 times. 10 kgs, do it for 2 times. 100 kgs, do it for 1 time, which improves muscle power. Thus, to improve endurance, 5 kgs, do it for 50 times. 3 kgs, do it for 100 times. 1 kg, do it for 1000 times, which improves muscle endurance. Right? So endurance exercises are different, and resistance exercises are different. Endurance exercises more of aerobic capacity. Resistance exercises are more of anaerobic capacity. So both are in different positions. Very easy question. Don't put the wrong answers. Okay, exercises which involve the patient with a particular aim. Very easy, right? So exercises that involves the patient with a particular aim is called as subjective exercises, general exercises, objective exercises, or local exercises. So subjective, objective, general, or local exercises. Everyone has given correct answer. It is the objective exercises. Why these exercises are given? Objective exercises. Why? Okay, so first I will tell you, general exercises are the exercises which are given for whole body. And local exercises which are given for a particular joint is called as local exercises. Subjective exercises are the exercises which we taught to the patient, like isometric quadriceps exercises, or straight leg raise exercises, or shoulder pendular exercises, are all these subjective exercises. Objective exercises are the exercises which we are going to give some aim, like ask the patient to climb the what is a wall ladder. Wall ladder exercise are objective exercises, right? Or ask the patient to clean the windows. It's an objective exercise. Ask the patient to open and close the door. It's the objective exercises. Why we are going to give the objective exercises? When you give a subjective exercises, patient feels doing exercises for twice or thrice a day. After that, patient will become lazy. They will not do the exercises because see, as these exercises have become very lazy. I don't have interest in doing these exercises. Like that, the patient will come and tell us. But when you do the exercises along with some goals, some aims, like so please clean the window with the right hand so that your movement of the hand will be improved. So patient will do a task as well as the exercise. The purpose of exercise will also be solved as well as the task is given. Wall ladder also. Please mark it where you are going to touch it. So patient will climb the wall and mark it. Today he touches it, tomorrow he touches it, and the day by day they will mark down on the wall, and thereby it helps to improve their. It enhances some goals we are going to keep. So always prescribe objective exercises. Subjective exercises has to be less prescribed. Patient will never do the subjective exercises. Okay, coming back to the very easy question of this whole slide. Straight leg raise is a form of what exercises to the quadriceps? It's isometric, isotonic shortening, isotonic lengthening, or isolating. It's isometric, isotonic shortening, isotonic lengthening, or isolating. SLR, straight leg raise. Very easy question in this type, I think. So that's what I told you from the first slide itself. What I thought it is easy is very difficult for you. What I thought it is difficult is very easy for you. Nobody has given a correct answer so far. I have seen around 5-6 answers, but nobody has given a correct answer. I don't know, maybe the questions, understanding of the question is wrong, right? So what is SLR? So here when I ask the patient to lift the leg, the quadricep doesn't do any activity. Leave the hip flexors. I am speaking about vastus medialis, lateralis, and intermedius. Doesn't do any activity. So it is a pure form of isometric exercise to the quadricep muscle. There is no isotonic shortening or isotonic lengthening because straight leg raise, the movement occurs only from the hip joint, not from the knee joint. Right? So the patient make the patient straight leg and ask the patient to flex the hip joint with the ankle in dorsiflexion position. There is no movement occurs in the knee joint, only movement occurs in the hip joint, and the contraction occurs in the knee joint is a pure isometric exercises. These exercises are also called as open kinetic exercises, although because the leg end is free. Maybe they think about the closed kinetic chain exercise, but these exercises are also called as open kinetic chain exercises. Right? Okay, we move on to the next question. So last 2 questions only. Okay, in the resisted exercises, progressive resisted exercises, 30 lift 4 times per week and it progresses to 10 repetition maximum once weekly is called as. In progressive resisted exercises, 30 lifts 4 times per week and it progresses to 10 repetition maximum once in a week called as Zenovit, McQueen, DeLong-Matkin, or Oxford. What is this classification? Zenovit, McQueen, DeLong-Matkin, or Oxford. Very easy question. Everyone knows that. When we study exercise therapy, we know only one person only in the progressive exercises. It's not Oxford. Oxford and Zenovit are same only. Okay, the right answer is DeLong's and Watkins because as you see in the textbook of exercise therapy, DeLong's is 10 lifts with half of 10 repetition maximum. Why we are going to identify repetition maximum? We are going to identify how much the patient was able to lift at one time. That is one repetition maximum. So once the patient was able to lift 10 kgs at one time, but 11 kgs he was not able to lift, then start giving a weight from 5 kgs. So half of the 10 repetition maximum, then gradually increases to 3/4 and then then to the 10 repetition maximum, and then gradually increase it to 10 lifts per week. Whereas in NACM stated that 10 lifts with 10 repetition maximum for 40 lifts for 3 times a week, and progress to 10 repetition maximum every 1 or 2 weeks. Usual prescription for the progressive assisted exercise is DLOMs and Watkins only. We always prescribe like that only. So we start only half of the 10 repetition, then 3/4, then the full of the 10 repetition maximum. Right, very easy question. Elderly patients are always advised to do what form of exercises? Isometric exercises, coordination exercises, endurance exercises, or assisted exercises. All the exercises are also given. I am not saying that the exercises are not given, but which is the best exercises for these patients, elderly patients? So isometric exercises, coordination exercises, endurance exercises, or resisted exercises. Which is the best for these patients, elderly patients? And say I'm accepting all the exercises are given for the elderly, but which is the best exercises which we are going to prescribe, especially for elderly? So patient comes with a fracture, patient comes with general muscle exercises. What exercise we use to prescribe? Isometric exercises we will not prescribe it. Right, as you are telling isometric exercises, I just overrule that, because we never prescribe isometric exercises to the elderly patient because of 2 reasons. One is the patient should not do Valsalva maneuver. That is, when you do isometric contractions, what happens inside the muscle is there's a vasoconstriction occurs at the blood vessels, right? So there's vasoconstriction occurs in the blood vessels, which may causes harm to the patient. So isometric exercises should not be recommended to the elderly patients. Though they have a cardiac problem, they do not have a cardiac problem, please don't prescribe isometric exercises, especially patient age after 60 years. Do not do isometric exercises. Resistance exercise is also not advisable. Still, there are so many literature supports that resistance exercises are also given for the patient with elderly patients, but still we are least teaching assisted exercise to these elderly patients. Coordination exercises, of course, coordination exercise has to be given, but general exercise when a patient comes here, you have to give endurance exercises to maintain the muscle tone, or to prevent fatigability of the muscle. We have to give a lot of endurance exercises. So kindly avoid isometric exercises, restrict the isometric exercises. If you are going to teach isometric exercises for quadriceps muscles, for a normal adult is 10 contractions, ask the patient to hold it for 10 counts. Do it for 5 counts for the elderly patients. Don't go for more counts. Valsalva maneuver, when the patient starts doing, which causes vasoconstriction of blood vessels, causes cardiac problems, right? So it has to be avoided. Last question of today's session: resistance are measured and provide a useful means of recovery. Which resistance helps to measure and useful means for recovery? Manual resistance, mechanical resistance, self-resistance, or gravity-assisted resistance. Resistance which are measurable and provide a useful means for recovery. Manual, mechanical, gravity assisted, non-gravity assisted.
Many of them are answering B, sir, in YouTube.
Yeah, B is the right answer. So mechanical resistance is the right answer, because mechanical resistance you are able to measure it. So when we are going to give 5 kgs in starting for 5 days, and then you can gradually increase to 6 kgs, 7 kgs gradually. So you are able to measurable the weight. As manual resistance, we cannot measure it. How much resistance I am going to give to the patient is different, and how much resistance you are going to the patient is different. So we cannot measure the manual resistance. Self-resistance also, patient gives self-resistance, which is not able to measure it. Gravity assisted, gravity is pulling it, so we cannot measure that resistance. So the correct answer is mechanical resistance. The last pictures of today is what is the Rohit Sharma question?
Screen.
So I just click some button. to share? Is it sharing?
Yes, sir. Yes, sir. Yes, sir.
I just hit some wrong button.
Yeah, no problem. What is the name of this derived
And
position?
great question. The Mr. Rohit Sharma doing, not Virat Kohli. Very easy. Last question. And same as don't expect the accurate as seen in your derived question textbook. It's more or less same. Not even trying. Kindly try, participants, please try. Okay. Pitch falling is a good try, but it is called a side falling. So we are coming to the end of today's session, and you can find more questions in my MCQ textbooks. So that's all for today's session. I'm happy that everyone has given the right answers for today's class, but still, I just want to advise everyone that please read the questions properly before answering it, because the first answer is not the best answer. Please think about it and read the question properly before answering it. Sometimes there is some questions which are hidden back on the question. So when you read it once or twice, you are able to understand it clearly. So please take the note of today's class. Please read the questions before answering it. Especially when you do shading with the help of the pen, then it is very difficult to change it. You got the right answer, but you shade it wrong. That was the best blunder we have to do it, right? So you can miss your seat within 1 mark or 2 mark, then it will be long lasting for your life. So next class also we are going to see the exercise therapy part 3. The components are bed rest complications, hydrotherapy, goniometry, posture, and group exercises, right? So next class is on next Wednesday on 9/6. We will meet you on 9. Till then, see you. Take care. Thank you very much.
Yes, sir. Thank you so much, sir. I will post the questions for today within next 5 minutes for our group members. And also small announcement, we are planning for 2 hours test also. So guys who are registered already, be ready for that. So start preparing for that. So we will be doing 2 hours test as like what you are going to do in the real entrance exam. Like that, we are going to give you the questions and you have to sit and work in 2 hours online. We are planning for that.
Whole physiotherapy syllabus will be covered from starting from anatomy, physiology, biomechanics, exercise therapy, ortho, neuro, cardio, everything will be covered.
Yes, sir. Thank you, sir. Thank you all. Bye bye. Good night.
Thank you, sir, very much. Good night, sir.
Yeah, good night, sir.